Like Kelly said, my name is Cody Wilson. I'm the manager of the surgery department here at Fairfield Medical Center, and thank you for having me today so I can speak to you a little bit about what we do in the surgery department. For anyone that doesn't know what surgery is, kind of put a little definition up here for you, just a procedure to remove or repair part of the body to find out if the disease is present. That may be something as in the form of cancer, or it may just be osteoarthritis, and we're going to replace your joint to give you a little better way of getting around in your everyday life. So Kelly went through kind of the overview of what we're going to talk about today. I'm going to kind of skip ahead, and I'm going to start with the different career tracks that we have here in surgery. First one is going to be the operating room assistant. That's something Allison's going to talk to you about here down the line of a position that she currently holds, and she'll give you a little bit more information on that as well. We have anesthesia techs, we have scrub techs, we have staff RNs, we have an RN first assist, and a surgical first assist. And I'm going to get into a little bit more detail for you with those positions now. So first up, we have our operating room assistant. This person is a vital part to our team. It's kind of the stepping stone to get in to the OR and advance your career. I'm going to go ahead and bring up the rest of these. So with this position, a lot of it's on-the-job training. We don't require a special degree. High school diploma or equivalent works best for this position. We prefer surgical experience with this, not something that you have to have. Like I said, we do a lot of on-the-job training. What this position details, they provide a lot of support for our OR teams as far as helping transport patients. They help move patients over on the table. They help with our room turnovers, and for anyone that doesn't know what that is, after every surgical case, the room has to be cleaned and prepped for the next patient. So the ORAs play a big vital role into that, helping out our teams turn over our rooms. They help build case cards for the next day for surgical procedures. And what the case card is, it's basically a big old metal box on wheels, and all the surgical instruments and supplies go into that box, and they go off what we call preference cards, which is basically a recipe. So if you've ever made a cake, that kind of goes through the list of everything you need for the procedure, and each of them are individualized. So just a couple roles of our ORAs highlighted there. Our next position is going to be the anesthesia technician. So with this position, everything that I just mentioned about the ORA applies to this as well. They do have a little bit more responsibilities as far as anesthesia. They coordinate with their anesthesiologists with supplies, different things they may need for the procedure. And a little bit higher on the pay scale with this position, same thing, high school diploma or equivalent. A lot of it's on the job training. It's hard to find someone out in the average workforce that has experience in the anesthesia tech position. So that highlights that position. Next on our list, we have our scrub technicians, or we call it scrub techs. You may hear that a little more in the lingo. The scrub tech goes to school. They have a degree. We prefer a certification, which is the CST. A couple of the schools that provide this training in the area, kind of local, would be COTC and Columbus State. A little bit higher pay scale than the last two positions, as it is a certification type program. What this position does, they help set up our sterile fields in the OR. They help the physician get everything they need as far as, your knife blade, your instruments. They pass those to the assist or the surgeon. They also help with counts in the room. Counts are especially important in surgery. You have, say, 10 laps, certain knife blades. You account for all of them prior to the procedure, and you want to make sure you have all those when you're finished with. Otherwise, it creates quite the headache down the road, and we don't like that. So this position also, like I said, is a person that helps with the sterile field. They help prep and drape the patient. And when they're not doing that, they're helping the ORAs, helping with room turnovers, helping with patient transfers and things like that as well. Our next position is a surgical first assist, and everything that I said about the scrub tech applies to this position as well. They do a little more extensive training. So they're the one that helps the physician kind of more hands-on up at the surgical field. They are the ones helping retract tissues. They may be helping bovie or cautery, different vessels within the body. They also are able to inject medications that are passed from the scrub tech, and they can help suture incisions closed at the end of the procedure. So a little bit more responsibilities for this person. One of the programs we utilize is the Meridian program. What this program does is allow that person to work in our ORs, get the experience they need, the cases they need for their education, and then as they finish that education, they do additional testing, and then hopefully our goal is to keep them on our team and on our staff and be able to employ them in that position to help out our team. Our next position is staff RNs. We have a variety of RNs within our surgical department. What we require from this position is an associate's degree. Bachelor's degree is preferred, and you must have an active license in the state of Ohio. A couple other colleges, Columbus State, COTC, Hawken College, and a few more kind of the local area colleges that provide the RN programs. So I'm going to go through a couple of the different details for our different areas for our RNs. So our first area, and I'll go kind of the process of surgery, you would start out in pre-op. So our preoperative nurses are responsible for bringing our patients in to the pre-op bays. They go through their history, medical histories, get the consent signed for surgery. They do pre-op medications. They're going to start your IVs and basically go through a lot of checks and balances to make sure that patient's ready for the procedure. Next, we have our intra-op RNs. This is the person who's going to come from the surgery department to the pre-op bay, and they're going to bring the patient back to surgery. So this person, once they get back to the OR, they're helping position the patient onto our surgical beds. They are helping anesthesia, intubate the patient, and put him to sleep. So they're often not caring exactly what's going on in the OR rooms. They're helping prep and position the patient for the specific procedures. They may be inserting Foleys or any other kind of lines that may be needed for surgery. And then they're documenting on the procedure as well throughout the procedure. Afterwards, they help with dressings, and then they're going to transport this patient to recovery. So once they get to recovery, this is where the PACU nurse comes in. They help recover the patient. They're going to monitor for any changes from baseline that the patient had in vitals from pre-op to make sure there's no significant changes. They help with pain medications, they're checking dressings, and they're going to go through the discharge instructions for our patient and the patient family so they can go home and recover, or they may be transporting the patient up to the floor and they'll be reporting off to the next nurse to make sure everyone's all on the same page. Our next position is the RN First Assist. So this is kind of a hybrid position. The First Assist that I just mentioned a couple slides ago, this position has all those same responsibilities. They just have additional training because they're also a nurse. So that's why the pay scale is a little bit higher. Same thing with the nurse. We prefer an associate's degree, or you need the associate's degree. Bachelor's degree is preferred. They would go through the same training as the First Assist. They do the cases in the OR with our team, get their case levels in or the case numbers that they need per their program that they're in. And then hopefully we can retain those people into our staffing and keep them here at Fairfield Medical Center. What we like about the RN First Assist position is they can function as the intra-op nurse or the First Assist or the scrub tech. So that kind of that hybrid role can be used interchangeably. So yeah, that kind of wraps up the First Assist or the RN First Assist. So next, I'm going to introduce Allison up to the podium. Allison is one of our ORAs. She is going to tell you kind of about her story and how she became an ORA and what she's planning on doing to further her career. So welcome, Allison.
Okay, I'm Allison. I'll just touch on some of these points that Kelly put up here. So I'm a 3-year employee. I started out in the respiratory department as a respiratory assistant. I worked in that department for a little over 2 years. Actually, August is going to be my 3-year anniversary of working at Fairfield Medical Center. I came into FMC with my basic, my EMT, so that kind of gave me some experience. But as a respiratory assistant, almost all of my experience was still on-the-job training, and that training definitely carried over into my position as an operating room assistant. Which was on-the-job training as well. As an operating room assistant, Cody touched on it a little bit, but we do room turnovers is a really big aspect of what we do. We set up for the next case, make sure that they have the instruments that they need or the soft supplies that they need, We run specimens from the operating rooms to the lab. We are runners for supplies during the cases. If they don't have something that they need, we'll run downstairs to the storeroom and bring it up to them. And then sometimes we'll also put the case cards together for the cases for the next day. And then my scrub tech career, so I decided within the past year or so that respiratory was not something that I wanted to do. So I looked at some other careers within the organization, and I came across surgery. So I went to HR and asked if I could have the opportunity to watch a surgery, because obviously it's not something that's for everybody. So I went and I watched the surgery, and I had interest in it. So I went back to HR, and they helped me apply to the OR assistant position. And I interviewed for the position, and then I shadowed with an ORA, and from there I got the position. And within the past couple months, I applied to scrub school, and I actually just got accepted, and that is through Columbus State, which I'll be starting in the fall. And Columbus State, their program is a 2-year program, and I'll finish with my associates in surgical technology. And the tuition assistance aspect, I don't know numbers. Kelly will talk about all of the numbers of the tuition assistance, but I utilize that. And I also I just applied for the Hard to Recruit scholarship. It was a super easy process. HR has been super helpful through it all, kind of giving you those steps to go through it. And there is the aspect of the time commitment, which I thought was a no-brainer. You get to go through school and have that stabilization of having a position afterwards, and going through school knowing you will be able to focus on that and have all of the resources to finish school without the debt. And that kind of touches on that. That's a little bit of my story.
I'm Kelly Sharp, and I am the Workforce Development Specialist at Fairfield Medical Center. The next thing I want to talk about, though, is how we can financially support you if you decide that you would like to go on your career journey, and what that can do for you, whether it's imaging or it's something else entirely different. But what we offer to start out with would be a tuition assistance, and that is for part-time or full-time employees. You do need to be employed with us a minimum of 6 months before you can utilize it, and it does have a 1-year commitment when you do use it. When you are part-time, it's $2,500 reimbursement every year, and then when you're full-time, it's $5,250 every year, and that renews once a calendar year in January. And then the next thing we have that's very specific to a few different areas, one of them being imaging, is well, actually, let me back up. This is not specific to anything. It's one of the scholarships that we have. We have 2 different types in the organization. This one is the Foundation Scholarship. And again, this is for part-time and full-time employees, and the amount's going to vary. You may have seen where that application was running this past summer, and the deadline just finished up for that for submission. But the employee does need to be employed with us a minimum of 1 year, utilizing the tuition assistance if it's applicable to you, and it is a 1-year commitment, and it's that you apply for that every summer. And when you apply for it in the summer, then they start their interview process towards the end of the summer, and then they go through that process in figuring out if you're going to be awarded and how much. And that amount may differ every year from the previous year if you were awarded that. The additional scholarship is the one I was originally referring to, and that is what we call the Hard to Recruit Scholarship. So that's specific to certain positions. So that is going to be imaging. It's also going to be respiratory therapists, MLT and MLS, which that's at our lab, and then registered dietitians, and surgery, so scrub techs. That is going to be, if you're getting an associate's degree, you're going to receive a $10,000 scholarship. And if it's a bachelor's degree, it's a $15,000 scholarship. And it's a 2-year commitment. The way this one differs a little bit is you really don't even have to be employed with us to get this scholarship. So we would love the opportunity to partner with you to see if maybe we have employment that would benefit you and us here as a team together, but you don't have to. So if you're getting ready to start a program or you know somebody in one of these areas, just reach out to me and I can send on that application process and talk to that person, and we can figure out how to move forward and find out if that's a good fit for them. But this is definitely a good way to go. And if you think about it, so from a perspective for if you are employed, you can use tuition assistance, you can use foundation scholarship, and you can use the hard to recruit scholarship. So by the time it's said and done, you've received a lot of financial assistance to help you achieve your goals. So for about career awareness and exploration, you can go to our website and you can just kind of look at posted positions if you're interested, and you can see what's posted, maybe what's out there, if you would like, just to kind of gauge what that even looks like. You can also job shadow in these areas. Say maybe you never thought of imaging before, or maybe you come to another one of these that we're having and you want to see what it even is like in those areas. We encourage job shadowing, so you could reach out to me and we can set that up, and I can work with that leadership team to do that. And then you can also email me, call me, and we can just sit down and have a conversation about maybe what your goals are and what you're thinking, and we can help work together to achieve what that is and help get you there.